How did Harold Shipman manage to obtain such large amounts of diamorphine? Have you ever wondered how a trusted doctor could misuse his position to commit unspeakable acts? Harold Shipman, a general practitioner in England, did just that. He managed to obtain large amounts of diamorphine, a powerful opioid painkiller, through several clever but unethical methods. First, Shipman overprescribed diamorphine to patients who were terminally ill. He claimed he was providing necessary pain relief. After these patients died, he collected the unused portions of the drug instead of returning or disposing of them properly. This allowed him to build a dangerous stockpile of diamorphine without raising immediate suspicion. Second, Shipman exploited his role as a trusted physician. He offered to collect prescriptions on behalf of his patients. Instead of delivering these medications, he diverted some or all of the supplies for his own use. This manipulation of trust was a key part of his strategy. Additionally, Shipman would visit the homes of deceased patients and collect unused drugs, promising to return them for destruction. Instead, he kept them for himself. This deceitful practice further contributed to his growing supply of diamorphine. At that time, diamorphine was classified as a controlled drug. This meant that strict regulations were in place, including the need for detailed records of its acquisition and administration. However, enforcement of these regulations was lax. The systems for inspecting and auditing controlled drug registers were ineffective, especially after the disbanding of the Regional Medical Officer Service that was responsible for oversight. This lack of rigorous monitoring allowed Shipman to manipulate records and evade detection. Moreover, the process for certifying deaths was poorly enforced. Doctors were often not scrutinized closely when verifying causes of death. This lack of oversight made it easier for Shipman to conceal his actions and continue his criminal activities without being caught. In summary, Shipman's ability to accumulate large amounts of diamorphine stemmed from overprescribing to terminal patients, diverting drugs through prescription collection, and exploiting weak regulatory oversight. His actions highlighted significant failures in medical governance and led to reforms aimed at preventing similar abuses in the future. The case of Harold Shipman serves as a chilling reminder of how trust can be manipulated for horrific ends.